Okay, great. I think we're ready to go. Welcome to the Green Ribbon Commission Climate Action Exchange. My name is John Cleveland. Along with my colleague Amy Longsworth, we staff the Boston Green Ribbon Commission. As most of you know, GRCx is our interactive virtual program series that's designed to support our mission of accelerating the implementation of the city's climate action plan. We're really pleased today to be jumping in and focusing on the role of anchor institution strategies in advancing climate action. Anchor institutions are organizations that are anchored to a place either through mission or through their business model. And Boston has a really extraordinary concentration of anchor institutions: healthcare, higher education, cultural institutions, and long-term real estate owner-operators. So today we're going to try to explore how anchor mission strategies can drive inclusive, local, and just climate action, including strengthening community resilience, increase access to clean energy, and developing healthy, low-carbon food systems. We got a great panel to lead off on this discussion. We have two folks who are going to give us some sort of high-level anchor institution 101 kinds of strategies and approaches and understanding. And then we're going to dive into two of those content areas, one around sustainable food systems and the other around community energy. So if you can go to the next slide, Lizzie. So our panel is going to kick off with Gary Cohen, who's the president and co-founder of Healthcare Without Harm. Healthcare Without Harm is a global leader in understanding the connection between climate change and public health and changing health system practices to reduce their environmental impacts, including their carbon footprints. We're really fortunate here at the GRC to have two Healthcare Without Harm staff. Many of you know Eugenia Gibbons and Winston Vaughn, who support and staff our healthcare working group. Gary's going to give us a basic overview of anchor institution strategies, and in particular why healthcare organizations really have been a leader in this movement. Next up is going to be Dr. Megan Sandel, who's co-director of the GROW Clinic at the Boston Medical Center. Megan is a nationally recognized expert on housing and child health and a key architect of BMC's anchor strategy. She's going to give us an overview of their strategy and how it relates to their organizational mission and why they see it not as sort of an add-on program, but as a core part of their mission delivery. Just a couple other notes on BMC, again, that many of you know. They are a member of the Healthcare Anchor Network and a leading practitioner in this area. And Kate Walsh, the BMC CEO, is one of the founding members of the GRC. And she, along with Ann Klebansky from Mass General Brigham, co-chair our healthcare working group. So we're delighted to have BMC on the program. Next is Betsy Skoda, who's the Community Food Systems Coordinator with Healthcare Without Harm. And locally, Betsy manages Healthcare Without Harm's Healthy Food and Healthcare program in New England. And she's going to give us a brief introduction to the regional food vision that's helping drive this change in practice on sustainable food procurement. And next up, so go to the next slide there, Lizzie. So we have David Maffeo from BMC and Jen Faigel from CommonWealth Kitchen. David's responsible for the coordination of support services at Boston Medical Center and leads their organization's sustainability efforts, which many of you are familiar with, and they have become real leaders in this space. Jen is the co-founder and executive director of CommonWealth Kitchen, which is a Boston-based nonprofit food business development center that has a mission to build a new food economy grounded in racial, social, and economic justice. David and Jen are going to share with us how the New England Food Collaborative is using the purchasing power of large institutions to build a sustainable food economy in the region. And then last but not least, we have Ben Myers, VP of Sustainability from Boston Properties. I always sometimes feel silly introducing Ben. Everybody knows Ben. And as many of you know, Boston Properties is the largest developer and manager of Class A office properties in the US, and the local president, Brian Koop, has been a longstanding member of the GRC. Ben's going to share with us a really cool project that they've been doing, which is an innovative approach to community solar, which both generates solar energy from panels on their parking structure and then shares net metering credits with low-income community members and organizations. So we're really excited to hear about that. Before I turn it over to Gary, who's going to kick us off, Just a couple of logistical notes. One, we are recording this session, and shortly after the webinar, you'll get an email with a link to the recording and also to the presentation materials. And it'll include a link to a short feedback survey, which we hope you'll help use to help us improve. If you do have questions for the panelists, please put them in the chat box. I'll be drawing from the chat box for the Q&A session. We have 25 minutes for a Q&A at the end, and we really want to focus there on how can we advance an anchor institution strategy here in Boston around our climate work. Last but not least, please mute yourself if you're not speaking, as we all know from these Zoom experiences. So Gary, I'll turn it over to you.
Thanks so much, John. And thanks everybody for joining today. I want to start with our current crisis that we're facing and the role that healthcare organizations play in holding the collective trauma that we are facing related to the COVID epidemic, and also being the epicenter for our response, because that's one of the critical roles that healthcare can play. We see that hospitals have become the ground zero in the battle against this virus. We've learned that the problems with the supply chain, the vulnerability of the supply chain, so that healthcare workers for many months of this pandemic didn't have sufficient protective equipment. So they were risking their lives to save others. In the current moment, when the governor announced that there was going to be vaccinations taking place, the original plan missed how to actually allow Boston residents to get vaccinated without having to drive to Gillette Stadium or other places in the suburbs. And Boston Medical Center stepped in and within a week had set up a whole series of places for people in Boston to get vaccinated that were on public transportation or within their neighborhoods. When I went to get my own vaccination at the YMCA in Hyde Park, one of the nurses on duty said to me, "Look, Boston Medical Center is a Category 1 trauma center and knows how to operate in crisis situations. It's what we do every day," she said to me proudly. And so it's anchoring that response to the COVID epidemic. If many people remember the marathon bombing years ago, when many people lost many of their limbs on Boylston Street at the end of the marathon. And where were they taken? In that moment of crisis, they were taken to the new Spalding Rehab Hospital, which had just opened, where they could be rehabilitated. And again, healthcare was anchoring the response to that crisis. In a climate emergency, both of those hospitals would also be the anchor for the response to a climate crisis. Boston Medical Center has installed combined heat and power, so it can run if the entire grid fails in Boston in a climate emergency. And it has black start capacity that allows it to kickstart its facility to operate, but also to provide the power for the emergency communication system for the entire city. That's what it means to be an anchor. Spalding Medical Center has all the emergency equipment and backup systems on the roof. So if there's flooding in Boston Harbor, they can continue to operate. So these are examples of designing healthcare facilities to be the anchors in climate emergencies. But that's not the only places where both healthcare and other educational institutions and other anchor institutions can play fundamental roles in our community. Often, healthcare and universities are the largest employers in a city. So Mass General Brigham is the largest employer in both Boston and the state. Healthcare organizations are often, and other anchors are the largest real estate owners, the largest purchasers of goods and services, the most powerful political forces. They're, as John said, they're rooted in place. So we know that there are four fundamental roles that anchors can play in a place that can address especially some of the upstream conditions that relate to how people are being made sick, that relate to the food access issues, the food insecurity, the institutional racism that lock people of color out of good jobs and contributes to massive health inequalities, the air pollution, the violence that people face, the addictions and toxic stress. And we know that the climate crisis, just like the COVID crisis, is a force multiplier for all these factors that contribute to disease and inequalities. So there's four fundamental roles that I'd like to just briefly touch on before I turn it over to the other panelists. One is that anchors can leverage their purchasing power to support the transition to renewable energy and other low carbon strategies. They can buy into wind turbines and solar fields that not only power their own facilities, but provide the infrastructure for their communities, as Gunderson Health System has done in Wisconsin, and BMC has done with its Black Start capacity, and Mass General Brigham has done with a wind farm in southern New Hampshire. They can use their purchasing power to support sustainable growers and fisher people in their regions and partner with schools and universities and build a food system that's both healthy and resilient and equitable. It can join with others to detox its supply chain, as Mass General Brigham and Harvard University has done when they both adopted healthcare without harm safer furnishing standard, and then led a market transformation over the last 3 years that contributed to over $700 million of purchases for safer furnishings for universities and hospitals. Over the next couple of years, Healthcare Without Harm and the Healthcare Anchor Network, which is a network of 50 different institutions all working on this strategy, are launching an impact purchasing commitment in the sector that gets healthcare institutions to double their commitment to BIPOC businesses, to strengthen their local purchasing, and to identify key environmental health procurement options that can lower their carbon footprint and drive toxic chemicals out of their products. The second role that anchors can play is around workforce development. Healthcare systems can provide good paying jobs to community residents in so many departments. At any one time, for example, Mass General Brigham has 3,000 jobs open in their system. So many systems are setting up job training programs for community residents to fill important positions and partnering with community colleges to build the pipeline of candidates for those jobs. The third role is around investments in healthcare, and other anchors can invest in their communities, can invest in housing stabilization, weatherization, energy efficiency programs that also remove asthma triggers from people's homes, as the city of San Francisco Department of Health is doing now. They can invest in solar energy loan programs for low-income residents, as Common Spirit Health System is now done in Florida. Or they can invest in building an entire food system strategy, as Kaiser Permanente has done in the San Francisco Bay Area by leveraging their $100 million of food purchasing to support sustainable BIPOC and local food production in the region. We're going to hear more about that a little bit later. So anchors can put their investment money, their savings, instead of into the market. They can invest in the clean energy grid in their communities, in the affordable housing in their communities, in the sustainable food and transportation system in their city. And the fourth role is around policy. Healthcare in particular in this state, in this city, and universities have enormous political power in the policy realm. So they can champion environmental health policies and racial justice policies bubbling up from the advocates and community members in their community. And when healthcare institutions speak, they have standing not only as the largest employers, but also as the guardians of health. So they can help to rebrand, reframe the climate crisis as a public health emergency that requires action as a public health intervention. So what we're starting to see around the country is healthcare anchors standing up for climate justice strategies. In Massachusetts, there's a Massachusetts Healthcare Climate Alliance that we run with a number of the hospitals in the state. And when the governor was launching this, updating the environmental justice strategy for the state, both Mass General and Boston Medical Center joined in a letter to the legislature and to the governor to consider health impacts in EJ communities, to involve community members in decision-making about projects. In Washington state, the largest healthcare systems are investing in and supporting with their political clout a Healthy Environments for All Act, which requires the state to incorporate environmental justice strategies, establish an environmental justice council, and ensure community participation in all major projects going forward. So in the remainder of the session today, we're going to hear from leaders who are implementing these anchor strategies in Boston. And what I want to say is that in the United States, there's no other city that has such a high concentration of higher ed education organizations, of healthcare organizations together. And we have a progressive city and state strategy around climate solutions. And so the possibility of actually setting Boston up as sort of the beacon of how do we redefine the healing mission of healthcare? How do we leverage the power of anchor institutions in this city to make Boston truly a model for the world is really a possibility that I think we should explore going forward. Thanks very much.
Thanks, Gary. Hey, appreciate that overview, and delighted you threw down the challenge gauntlet for us. So we'll set our bar high. Terrific, thanks. So next we're going to hear from Megan, who's going to again kind of drill down to the next level of detail and talk about Boston Medical Center's anchor institution strategy and what it encompasses and why it's critical to their mission. So Megan, I'm turning it over to you. Thanks.
Great. Thank you so much for having me this morning. And it's just an honor to be part of this great panel. And thank you so much, Gary, for kind of helping to set up what anchor institutions kind of mean. I think what I'm going to be here today is sharing, honestly, the experience of BMC through, honestly, a group of leaders. And so in many ways, I need to give a shout out to our Vice President of Mission, Dr. Thea James, Associate Chief Medical Officer. She really is our leader on all aspects of our anchor work. You're going to hear later in the panel from Dave Maffeo and under Bob Biggio, our Vice President of Facilities and Operations. Really, we are proud of our kind of world-class kind of leaning in on a lot of these different strategies. I'm going to focus today mostly on our housing strategy, but I'm going to try and give a broader overview of how we're thinking about place-based investing. And then also talk a little bit about where we're heading in terms of thinking about different levels of procurement and policy. I will just say, before I kind of dive into my slides, I want to kind of give you kind of 3 themes that I want you to pay attention to about how we are trying to do our anchor institution strategy here at BMC. I think the first is this concept of intentionality, that you have to look at each of the processes, understand the data, understand how are we going to get better. And so to an extent, I think it's really important. People can say they're anchor institutions, but are you actually going from that kind of initial commitment to an intentionality in these areas? I think the other side of it is really, it's a lot about relationship building and capacity building. And so at each of these, it's who are the leaders within the institutions? What are their relationships with leaders outside the institutions? How do we start to really build across institution kind of relationships? And I'll highlight some of those kind of themes. And then the last is this concept of equity. I'm glad that Gary gave a shout out to the vaccine sites, because for us at BMC, it was really important to infuse equity into a process. And so where you cited the vaccine sites was part of the equity process, right? A YMCA, a church, community health center. Those were trusted places, that they were places on public transportation. They were places that were close to where people lived. And those were all part of doing the process differently. I think that sometimes we think we can make an equity commitment and then not do a process differently. And we know that that's the definition of insanity, right? Is to do the same thing over and over and expect a different result. And so I'm going to highlight kind of how do we infuse equity into the process, into the ecosystem at different themes. For those that aren't familiar with the Healthcare Anchor Network, I really encourage you to check out the Democracy Collaborative's website on this, where you can see not only the current participants in the network, and it's over 50 health systems right now, but also how we as a network learn from each other. How do we connect? How do we share best practices? How are we able to collaborate and lead together? And I'll just say that we in New England have been doing our own mini collaborative also, so that we can learn not just at the national meetings, but also locally. If you go to the next slide, I think that as we think about this, as Gary alluded to, we're operating in 4 different ways, right? It's local inclusive hiring, it's doing place-based investing, it's doing inclusive local sourcing, and then it's doing things like policy work. And so I want to give a shout out that over the last couple of years, we've been doing national policy days for Housing is Health, trying to really redefine to policymakers that investing in housing actually has health implications. And so having kind of not the usual suspects showing up becomes part of the change. And I'll give a local example a little bit later in the slide deck. So if you go to the next slide, I think that for us at BMC, local hiring has been really about how do we set up really goals, and how do we partner with both city infrastructure and other infrastructure in terms of being able to identify really key candidates that we can improve our workforce by partnering. So one example is in 2018, we partnered with the city of Boston around their Boston Hires initiative, which was focused on specific zip codes that where people were either unemployed or underemployed. And so over that year time period, we hired over 400 residents who were either unemployed, underemployed, or seeking new jobs. And we were able to get them into our BMC kind of full wellness program. Many times when people become our employees, they also become our patients. And so this was a huge way in which we could use our hiring platform as a way forward. And I'll just give you a note that we are integrating right now hiring into our concepts of social determinants of health screening. So we don't just screen people for housing instability or food insecurity or problems paying for medications. We also ask, are you unemployed and seeking a job? And we're trying to figure out what are the pathways in which we can identify people within our healthcare institution and then be able to connect with key leaders. For those that may have seen, we actually recently were awarded a JP Morgan Chase Advancing Cities grant, a $5 million commitment to building a bigger Boston Opportunity System collaborative. And so we're partnering with really amazing organizations like Action for Equity to try and identify new kind of pools of candidates, and then also trying to make new job commitments at family sustaining wages or higher. And so how do we start to think about that? I will just note that we also have partnered with the Possible Project around ways in which to identify juniors or seniors and having them come onto campus, and then also now partnering with them to try and think about what we sometimes will refer to as like a 13th year, right? You're not ready for college, you want a work experience before you go to college. How do we start to define those and move those forward? If you go to the next slide, I think one of the things that we have been really trying to lead on is investing. And so we made a commitment in 2017 of $6.5 million as part of our determination of need obligation, where we said to the Department of Public Health, listen, you want us to do a community health initiative on a determined need. And we think the most determined need in the community is the lack of affordable housing. And so we are going to ask, can we commit all of the money into housing and place-based investing? And they said yes. And so what's exciting about this is that we as BMC made this initial commitment Boston Children's and Brigham and Women's followed with some of their commitments. BI Leahy or BI Deaconess just put $7 million as their initial commitment into housing. So I think this is where, again, when one hospital does it, other hospitals can follow and we can all work and learn together. To give you an example of the next slide of how we have implemented our investments, we have done it thematically in partnerships. So I just want to be clear, we as BMC are not building our own housing. We're not becoming a landlord. We are really viewing that our role is to strengthen the local ecosystem. And so what are the ways in which we do that? Well, part of it can be thinking about project-based specific investments. And so when we initially had the obligation, Dr. Thea James and I went around and we asked people kind of, what's your pain point? What's the thing you wish you had money for? And so for Nourishing Our Community Dad, they said their pain point was actually they were building a beautiful new building in Nubian Square on the old Bartlett station. And they wanted to put a grocery store in the first floor and they couldn't find the financing for it. The initial financing fell through. They wanted to attract a new grocery store. What were the ways in which they were going to do that? And so we ended up putting up $1 million no interest loan that was then matched by the Kresge Foundation to try and cover the fit out costs of that first floor to attract a new grocery store operator and owner. Codman Square had just inherited a building out of foreclosure that was falling apart. And so we brought initial financing to help them kind of stabilize the building and seek new financing so that they could actually renovate and get that building up to code and make it better. We did service collaborations with the community builders and Madison Park Development Corporation, which was really crucial for us, especially in the pandemic. We were able to continue to provide services on site at affordable housing developments. We've been thinking a lot about creating new housing opportunities and particularly addressing the permanent supportive housing needs of places like Boston Healthcare for the Homeless, Pine Street Inn, and partnering with key leaders like Boston Housing Authority and actually Cambridge Housing Authority to create new affordable housing opportunities for people at the lowest incomes. I'll describe in a minute, one of the things we wanted to do was strong community engagement strategies. And so we actually founded something called the Innovative Stable Housing Initiative, which was where we said, community has the answers for stable housing. We as hospitals don't. How do we do participatory action grant making in ways? And this was where we put up $1 million and Boston Children's matched the $1 million and Brigham and Women's brought $750,000 to new ways. Instead of doing grant making individually, we are doing grant making collectively. And then last but not least, we actually have been starting to doing investments, actual investments in things like the Healthy Neighborhood Equity Fund, which actually creates new affordable housing in gentrifying communities, preserves affordability, and focuses on transit-oriented development so that people can live in community, not need a car. And we are trying to look at new ways to do investing in small business development. We did a small solidarity bond with the Boston Impact Initiative. So to give you a deeper example, if you go to the next slide, we are trying to work right now on how we can lean in, not just with an investment loan to try and stand up a market in the Bartlett B building, which is along Washington Street, but also how do we lean in around, could we be working with, Dave Maffeo has been saying, let's think about ways in which their teaching demonstration kitchen and our demonstration kitchen can work together. How do we drive some of our employees on the way home to stop by this market? How do we even use our procurement power in ways that we could help reduce some of the costs of operating this market? How do we provide community outreach grants and other operating support? How do we ask this market to make sure that it is a Black owned and operated market so that we transfer ownership over time? Those are all ways in which we are trying to push ourselves with that intentionality to try and infuse equity into every step of this system. If you go to the next slide, one of the things I'm the most proud of is this Innovative Stable Housing Initiative, because one of the things that we were able to support was what we would call upstream grant making. So before the pandemic, we provided organizing dollars to coalitions like the Coalition for Truly Affordable Boston, and being able to provide planning grants to the Greater Boston Community Land Trust Network and to the Male Engagement Network. And what that resulted in is that hospitals and community groups were showing up early in the pandemic and saying, we need an eviction moratorium now. And so Massachusetts was one of the earliest states to pass that state eviction moratorium, and it was one of the strongest eviction moratoriums. And that resulted in us being able to stave off a lot of the eviction crises. I think that it's a great example of how we are leaning into not just the usual grant making or investing, but also really about building relationships across groups so that we can have those policy wins. And so for the last slide, I just want to share with you some examples of how intentionality works in terms of data. So this is our procurement numbers around diversity spend. And what you can see is that when we started tracking the numbers in 2018, when we first joined the Healthcare Anchor Network, we had a pretty measly spend. We were only helping about $2 million of our, hundreds of millions of dollars of spending. So we've been able to improve that over time to getting up to over $20 million. I will say this is still a drop in the bucket of what we can achieve with intentionality. But I do want to give you a sense of, it starts with that intentionality. It starts with that relationship building so that we can find new opportunities and ways in which we can support the ecosystem moving forward. I think you're going to hear a lot about how we as BMC want to be leaning in building an opportunity system that actually works for everyone. And that requires doing things differently in how we invest and applying equity rubrics. It means doing differently in the job markets. I think that there still is a very racialized job market, and we need to lean in a lot harder in terms of getting people to family sustaining wages that live in the lowest income zip codes in Boston. And then we need to be doing a lot more in the procurement spaces and in the policy spaces so that we can use our outsized voice in order to make sure that we're getting forward. And so I'm really excited to stick around, answer questions, and I'll turn it back over to the next panelist. Thank you.
Great, thank you, Megan. That's just really cool and really inspiring. It's you've put your money where your mouth is, so it's great to see. It's great to see that. We're gonna go one layer deeper now with David and Jen, who are going to really dive into the nitty-gritty details of how you apply an anchor institution strategy to transforming sustainable food systems using the procurement power of these institutions. So I'm going to first turn it over to Betsy, who's going to just give us a little bit of a background on sort of what the regional food vision is that this work gets done under, and then David and then Jen are going to dive into the details of their actual food initiatives. So Betsy, I'm turning it over to you.
Great, thank you, John. Good morning. So as John said, I'm going to share some background information that will connect how the work in Boston is related to these broader efforts that are underway in New England to transform the regional food system. Next slide, please. So before I do that, I just wanted to share background on how healthcare and healthcare without harm approaches the food system work. So we employ an environmental nutrition framework that holds that healthy food cannot be defined by nutrient quality alone. And we really need to look at the system behind the food to understand the broader impact that food production and distribution has in our world. And this is important because over the last 50 years, there's been tremendous consolidation in food and agriculture production, with diversified farms growing, multiple food items have given way to specialization, and fewer companies, produce, process, and distribute our food. And then there's also been consolidation geographically, and the consolidation and concentration of production, has contributed to the decline of rural economies. It means there's less diversification of crop varieties. These rigid distribution systems that are more vulnerable to disruption, as we saw during COVID-19. And this system, this consolidation and concentration has contributed greatly to environmental degradation. Food production contributes significantly to greenhouse gas emission globally. And climate change will impact food production and how food gets from farm to table, and including contributing to, inconsistent supply and also rising prices. So there's great opportunity in changing how we produce and procure food, and changing what we eat can help ensure broader food security, improve health outcomes, and also build stronger, resilient communities. So next slide, please. So the way institutions spend their food budgets can have a profound impact. And so in New England, Healthcare Without Harm works with a number of regional collaborators, including Farm to Institution New England and Food Solutions New England. And across the networks, there's been a lot of research to understand what the opportunity is for food system development in the region, as well as what's currently happening now. So Farm to Institution New England did some research a few years ago and found that institutions were spending around $730 million annually on food and beverages. That number is actually probably higher. That number is based on the number of responses that were part of that research. And additionally, we have the New England Food Vision. So the New England Food Vision was a proposal for what could happen in the region with a commitment to growing the farm and food economy in a just and sustainable manner. And when the vision was released in 2014, the research behind it found that an estimated 90% of the food that we consume in New England comes from outside the region. So when institutions support local and regional procurement, they can contribute to creating a more adaptive system and creating new economic opportunities, and their purchasing dollars have a real impact as they recirculate in the communities and have a multiplier effect. And so with the regional collaboration with the New England Food Vision, New England is really well positioned to make great strides towards creating a more sustainable and resilient food economy. In addition to the food vision, each state has food system planning efforts underway. And then we have this, these regional networks that support the collaboration across state lines. And as an outgrowth of the work that's been happening over the last several years and the vision, there's also a new effort called New England Feeding New England, which will bring together representatives from the 6 states, from state agencies, nonprofit organizations, and businesses, to examine how to grow food in the region and to try and increase the amount of food that we're growing and consuming in the region, up from this level of about 10% now to 35% by 2035. And this effort will really focus on, creating a sustainable and resilient regional food economy. And the work will also center on equity. And so finally, we're very well positioned in New England to make these changes because of the number of institutions that are here that are also recognizing their role as community anchors. Next slide, please. So in 2018, Healthcare Without Harm engaged a set of anchors and food system partners to identify a project that could leverage the institutional procurement resources in the region to advance development of the food system. And across this project, we've had representatives from different states, a variety of institutions, and also, different people from within institutions. So we had dining leads, sustainability, and community benefit from the hospitals. And in initiating the project, we aimed to build off the learnings from the Anchors and Resilient Communities Initiative, which is a collaboration of Healthcare Without Harm and Emerald Cities Collaborative in the Bay Area, which brought together anchor institutions, with community representatives in an effort to, co-create projects that would transform the community. And that work led to an initial project around a new food center that would produce meals for Kaiser Permanente to help Kaiser meet its procurement goals, and also for other institutions. And the focus there is sourcing from the local community and creating new jobs. So building off of that, we sought to further connect with our regional collaborators. And we began our work by creating a set of shared values that included community health, community wealth, environmental stewardship, and transparency, and supporting the collaboration between the processors. And we emerged as a project that aligned with those values and created an opportunity to make it easier for institutions to access New England grown products year round. So investment in light processing is an ideal way to preserve the harvest, produces picked at peak ripeness and retains nutrients. But processing is also creating a new market for regional farms, creates this product that institutions can use more readily, and the new job and career opportunities within the food system. And we were able to kind of put this project together because we had these strong processing operations in the region with CommonWealth Kitchen, Western Massachusetts Food Processing Center and the Center for an Agricultural Economy in Vermont. And these processors had collaborated in the past. They're primed for growth, and they're committed to sourcing regional foods and to creating good jobs with livable wages. And they also support the broader food ecosystem by providing business incubation services. So the long-term goal of this work is to create ongoing purchasing partnerships between institutions and the processors that help them meet their goals. And a key part of this is working together around planning so that we're reducing the risk for producers and making sure institutions have what they need. And together, the collaborations like the collective, the regional planning initiatives, and our cost sector networks are really working to advance this realization of a more resilient food system that's capable of serving people and institutions on an every day in normal times, as well as in the face of disruption. Next slide, please. So I wanted to include resources for you to consider, to learn more about these projects. Our team at Healthcare Without Harm is supporting the Cool Food Pledge, which is a way to decrease greenhouse gas emissions related to food. There's great work being done with Farm to Institution New England. And I also included the link to the Good Food Purchasing Program, which is the Good Food Purchasing policy was passed in Boston in recent years, and will provide some good support and information for transforming the local food economy.
Great, thanks, Betsy. That gives us a great umbrella framework for David and Jen to jump into the details. So David, I'll turn it over to you.
Thanks, John. So I'm going to spend most of my time today talking about a program we call Nourishing Our Community, which is how we are addressing food insecurity in the community we serve. Next slide, I do want to talk about who we are as BMC first. So we are a 427,000 member health plan, 514 bed teaching hospital. We're New England's largest safety net hospital. And I really want you to focus on greater than 80% of our patients are publicly insured or uninsured, and 50% of which fall under the poverty level. Next slide, please. This is a recent report that came out from the Greater Boston Food Bank. It's really troubling numbers. We knew food insecurity was an issue. It became a lot worse with the pandemic. So 59% increase in food insecurity. 1 in 8 individuals are food insecure. 1 in 5 are children. And the households that are food insecure doubled since the pre-pandemic. Next slide, please. So what are we doing? So we have a program called Nourishing Our Community. Our food pantry is the first, and you can see the picture in the middle, that's Latchman Harrellow. He's been with us since the beginning. It's the first one of its kind in the country. I like to refer to it as a food pharmacy. Then came the teaching kitchen, which you see on the left, and you see the farm, which is behind me in the visual, but also you see the farm, which came in 2017. And we're using all 3 of these programs to create a sustainable food infrastructure in the city of Boston and make sure we're taking care of our patients the way they need to be taken care of. Next slide, please. So how the Therapeutic Food Pantry works. Individuals are at risk of malnutrition are screened, and based on that screening, they can be prescribed to the pantry. They can go to the pantry 2 times a month. They receive 8 days worth of food, and we feed the entire family, not just the patient. A key feature of this, and you see in the picture, that's Lindsay Allen, who's our rooftop farm manager, delivering food from our farm to the pantry to support the patients. It's very hard to get local sustainable food in the city of Boston, and we're doing our share from the farm. So that's Lindsay in the picture. Next slide, please. Just to give you a sense of, where we started, when the idea came about back in 2001, the idea came from a pediatrician here at Boston Medical Center named Deborah Frank, and she went to administration and said, we need to do more about, malnourished and food insecurity. And at the time, we were budgeted to see 50 people, 100 people a month, and you can see what it's grown into. So this past year was close to 70,000. Even in the pandemic, with less people coming to the pantry, we delivered to houses. So currently we deliver to 150 families across Boston, food that they need to survive, 8 days worth. And in 2018, another troubling number, we had 1 million people served. So really, when you look at this slide, what we're trying to get to over the next 10 years is you want to see the slide back to where 2002 was. What success will look like is we no longer have a food pantry. Next slide, please. Then came the teaching kitchen. So 2001 was a pantry. We said, now what? So we're giving them food. What can we do? We can do more. So we created a teaching kitchen in 2003 to teach our patients that were coming to the pantry how different techniques, how to cook with the food that they picked up. So we built a robust program through the years. This is Olivia Weinstein, who is a chef dietitian. She's doing a lot of virtual now, but this is our teaching kitchen in action. We're also part of the Teaching Kitchen Collaborative, which is many teaching kitchens across the country sharing best practices on their programs. So we're really looking at the application nutrition. We're trying to change behavior, and we're using strategies to overcome determinants of health. Next slide. And this is who we're serving in the teaching kitchen. So our adult patients, staff and students, children from our pediatrics clinic, and also the community we serve. Next slide. So this is some of our classes that I want to highlight here. So from a patient perspective, we have cancer classes, chronic pain, bariatric weight loss surgery. So really teaching skills so they can get healthy and sustain their health when they go home. And community partnerships, our own BMC Health Net plan, Boston Police. Not last summer, but the year before, pre-pandemic, we had 250 students from Boston Public Schools come out to our farm, spend a half day on the farm, and then go to the teaching kitchen to learn how to cook with the food they just harvested. So we're really trying to take a holistic approach to what is food, how it's grown, and how you can utilize it at home and grow on your own. And then staff and student, I want to highlight the program on the bottom, Eat to Treat, really unique program that, Tracy Berg, who's our former teaching kitchen dietitian, and now it's sustained with Olivia. We're teaching future physicians on the impact of nutrition on diets and how they can make a difference. So it's a program with BU students. We've done it for 3 years now, and it's been very successful. Next slide. And then came our rooftop farm. So we started in 2017. What you're looking at here, this is on our power plant roof, 2,300 milk crates with Vermont composting soil, growing 25 different crops for our patients. Not only our patients in the pantry, but our employees in the cafeteria, our patients that lay in beds in our hospital, and we also utilize it for a farmer's market too. And that's Lindsay harvesting with her assistant. Lindsay started with us right from the get-go and has done a fantastic job. Next slide. So really, what are the benefits? So for us, we're using it to offer affordable. This is Lindsay in one of our cafeterias when we have a farmer's market weekly. We also allow local farms like Nubia Farms here in Boston in our lobby in our Shapiro building to have a farmer's market as well. So we really want to work together with that. And I mentioned the pantry on a previous slide. 60% of the food goes to the pantry, and the other 40% goes to the location that I mentioned. I did want to mention with the pantry, Greater Boston Food Bank is our greatest partner. We could not do what we do without their support. So most of our food we get from Greater Boston Food Bank, and then we're supplementing it from a rooftop farm. Next slide. This is a class I mentioned a couple of years back, with Boston school system, very successful. There's a couple teachers in the background. We did it, of course, over several weeks. But this is really what we're trying to morph into. Year one, we really wanted to grow as much as we could to give it to the patients that come to the pantry and those in need. We really want to do more intervention, more education. So every Friday, we have something called Friday on the Farm. It's an Instagram series where Lindsay does videos on gardening, bee harvesting, honey, and other classes that she's showing the BMC community. Next slide. There's also some great sustainable benefits. You heard a lot of it from Gary and Megan about what we're doing in terms of sustainability with energy. But there's also great benefits of a green roof: reduction in heat island effect, reduction in stormwater runoff, energy saving, less heat used in the winter, cooler in the summer. So there's many other reasons to do a green roof. Next slide. Betsy talked about collaborative. So, our other vision is to make sure we're taking care of the economy in all that we provide to our patients here at Boston Medical. So Betsy mentioned the collective that we're doing, 6 farms in New England. You can see some of the usage. So 5,500 pounds of frozen vegetables that we're able to provide our patients here, in the winter when it was harvested in the summer. So it's been a very successful program. We commit to it again this year coming. I'm looking forward to that partnership, as well as the Gloucester Fishermen and Wives Association. So for the last 10 years, we have purchased only fish from Gloucester. It really helps the fishing economy. Angela Sanfilippo is a great partner of ours. It's a better product for our patients, a lot better than frozen, and it's only traveling from Gloucester versus other parts of the country. Through our partner, Morrison Healthcare, we only use Sid Wainer. Sid Wainer does a great job with their sustainability efforts, only using local farms in Massachusetts. We're only buying our meats from Dolan Bailey. Dolan Bailey's been around since the late 1800s. They're great to work with. They have a program called Northeast Family Farms, where we buy only grass-fed beef, which is much better for our patients and our employees here at BMC. Next slide. So these are, some of the farms that we purchased through Sid Wainer, from Natick to Amherst, to South Dartmouth. Next slide. Here's more of them. So 16 farms in total. That's where all our produce is coming from, as well as our own farm. And I think last slide, please. A few years back, we looked at, everybody has annual goals. What can we do in the next 10 to 12 years to make a difference in the community we serve? And this is our vision, to make Boston the healthiest urban population in the world. So really through these sustainable efforts, through these partnerships like Betsy talked about, through the partnership that Megan talked about with Good Food Market, we're really looking to make a difference on the community we serve. Thank you.
Well, thank you, Dave. That's great. A great example of moving upstream, as Gary was describing. So Jen, I'm going to turn it over to you. Talk about the kitchen.
Excellent. Thank you very much. It's nice to be in such inspiring company with folks doing some really powerful work, and a group of people aligned around this idea that the work we're all doing, it's very intersectional. You can't look at any one of these pieces and say the way that we solve health is only through medicine. The only way that we solve, food security is just by giving handouts, right? And so the work that we do at CommonWealth Kitchen is really trying to think about using food as a way to really think about how do we actually address some of these like structural issues that affect the ability for women, immigrants, people of color to build real businesses as a means of building wealth. For lots of you have probably heard these stories that here in Boston, it is one of the most unequal cities in the country. White population, average net worth of $247,000, Black family net worth $8. $8, that's all they have. So we know in our work that small business, besides housing, is one of the best ways for people to actually build wealth and assets, which is a way to build self-sufficiency, which is a way to build self-determination and how you want to live your life. So our work is really in a very theoretical way, but it is very much about how do we actually change the underlying structures for people of color to start and build food companies. You can go to the next slide. And so CommonWealth Kitchen, We are a food business incubator and development center. We started out as a shared kitchen. So think about it as a gym membership for food companies. So you want to start a business in food, the hardest thing is the cost of the kitchen. So come and rent our kitchen by the hour and you get access to $2 million worth of equipment as you need it. And then we provide you with this incredible array of wraparound education, training, business support. You think about making cookies at home. How do you scale that cookie recipe? It's chemistry, not math. How do you think about that cookie? Where can you sell it? Does the world need another cookie? How do we support your business and thinking about where you can take your product? And our work is very much grounded in this idea that that by working at the business level and supporting the businesses, we can move toward building the world that we want to see. You can go to the next slide. And so the kitchen that we do, and so this is kind of the very simple background on our day-to-day work. Our shared kitchen, over 50 companies, over 75% of the businesses are owned by people of color. It is very intentional. I love that Megan talked about intentionality, because all of this work, the key to any of this is we have to be intentional. We have to live our values. If we're not doing that, then we're just rearranging the deck chairs. And so our work is really being in very deep partnership with our business owners along their journey from the idea of that cookie all the way to how do we scale that to a successful business, success defined by the business owner. So we really take this kind of human-centered design approach to what we do. You can go to the next slide. And so the work that we do really has multiple pieces to it. So think about the journey of a business owner. They need a kitchen. They need to understand how to scale their recipe. They need market access. So a lot of the businesses we work with, they make products that may be unfamiliar to people who look like me. The African peanut sauce and the Haitian pickles, and so how do we help these businesses get access to markets when they don't have personal wealth, they don't have friends and family connections, they don't have industry networks. The food industry, as we have learned, is incredibly opaque, very hard to figure out how to maneuver. And traditional retail strategy for product companies can be very expensive. And thus we started looking at, well, where are there other opportunities and concentrations where there are eaters who would be excited about the Haitian pickles and the African peanut sauce? And immediately in a place like Boston, you have to look at the college and hospitals to see who are the employees, right? Who are the students? What is it that they care about? And the volumes that they're eating are significant. It is one of the largest places where people are eating outside of the home in the state. And this was pre-COVID. So in COVID, it's a whole different universe, and we'll see where this goes. But so for us, a strategy of saying, how do we help our Black, Brown, Indigenous, women, immigrant businesses get access to sales at Boston Medical Center, Harvard University, Children's Hospital, that can be a key strategy to helping these companies scale and become successful businesses. One of the challenges we saw very early on was the scaling question. And all of this is the devil's in the details. And so a challenge for our businesses, if they're talking to Dave, is Dave's going to say food safety, insurance, risk management, like all the unsexy things that no matter how much they want to do it, that there are people in their organizations that are going to make it very difficult. And so for us as an organization, we said, well, what is it we can do that can break that breakthrough for those businesses? And that's where we started doing our own manufacturing. What we understood was when our businesses are at a certain size and they're artisan, that works well for getting them into small markets, small grocery stores, maybe starting to get them into some regional grocery, but even that's a challenge for them to be at the right scale. The jobs that these businesses are creating are very part-time, they're seasonal, they're intermittent. So these are not great jobs. And the business owners can get stuck because they just are in between. They're not big enough to go to scale their production. They're not big enough to get these kind of contracts with these institutions, but they are at a point, but they're not at a point where they're actually making money. And so what we saw was an opportunity to essentially aggregate lots of little projects for our business owners into full-time jobs on our staff doing manufacturing. And so we do that now. We do manufacturing for probably 24 different businesses. We make cookies and hummus and hot sauce and marinades and chai tea and all sorts of products that allows our companies to go out and sell their product while we are aggregating that work into full-time jobs with benefits, paying living wages to the staff in our kitchen. That has the added benefit where we as an organization then are able to invest in the infrastructure that's needed to get into these accounts. So we can manage the food safety issues. We can work on the nutritional regs that are required. We can make sure that the distribution is what it needs to be, and essentially just reduce the friction along the supply chain that makes it really challenging for these small, under-resourced businesses to be able to access these markets, because we know that the market wants it. We know that the interest is there. It is about sort of leaning into all the work it takes to go from concept into that sales channel. The other thing that the manufacturing work has allowed us to do is that now that we have this, it allows us to think beyond our business owners into the regional food economy more broadly. So you think about farms and food waste as an enormous challenge. So 40% of all food in the world is thrown out. So despite everything you just heard from David about like how wonderful it is that we're doing with food banks, but also how challenging food insecurity is, in fact, it's such a fixable thing. Like, what can we all do? And we saw this and said, well, if farmers are hitting peak points in the season when they have surplus that is all being thrown out, well, isn't there an opportunity here in New England for us to do something to preserve the product? So we started going out to our farmers and saying, well, what would it take? What do you need? And they said, well, we need somebody who can develop a recipe. Okay, we can do that. We need somebody who knows how to preserve the product and get all the permits and everything else. Great, we can do that. And so we literally started a program a few years ago where we are doing what's called value-added processing for farms. We work with over 24 farms across New England now, making tomato sauce, pickled vegetables. We make vegetarian tots that are on the menu at places like Boston Children's Hospital and Harvard University. And all of this was simply because we had invested in the infrastructure to do manufacturing, and that the manufacturing was at a scale that allowed us to be very nimble, which is not what the food industry is at all. Right? Food industry, you know, Betsy talked a lot about this, that it is big, it is monolithic, it is centralized, it is not anything but nimble. And it therefore does not work for all the businesses and community we want to support. And so the work for us over the last few years has been really trying to figure out that Venn diagram of how do we support the work we're doing with our regional farms to support purchasing from them and creating products that can be put into institutional accounts. We still make kale and arugula pesto that is on the menu at Brigham and Women's Hospital. It is a 100% local product. We make it in season, we freeze it, it goes into the hospital during the year. How did we get that done? Because the hospital said we care at a senior level. But then they looked at Sodexo, which is their company that does this work, and said, Sodexo, you must make this happen. And we are going to hold you accountable to make it happen. And then the Sodexo senior staff had to look at the Sodexo line staff and say, no, it really does matter. Make that happen. And the Sodexo junior staff had to look at the distributors and say, hey, distributor, you got to put it onto the truck so we can get the product. We had to then look all together to say, how do we have a transparent process of how markups work? Because we got to get the pricing to be, we're not price agnostic. It's more expensive, but how do we make it as reasonable as we can get it? And so we had to then sit and work all the way across all of those pieces to connect those dots from farmer to us, to the distributor, to the buyer, to the chef, to the patient or the cafeteria. And that is an enormously challenging to get that sorted out. And the other challenge that we run into, and that was in one hospital with one product. So imagine how you try to do that across hospitals or across colleges, right? So we were working this time last year, we had 3 companies with products on the menu at Harvard University. African peanut sauce, Mexican mole sauce, and a Chinese ginger scallion dressing. I feel like I'm out of central casting when I talk about the things we're doing. for those business owners, each one of them, that was an $80,000 to $100,000 piece of business for them. Top line, not enough to like make them rich, barely enough to even cover their costs because the margins are so terrible.
Jen, I want to just interrupt a little bit. I know you have some more slides. I just want to make
Oh,
sure
sorry.
we get to some Q&A time.
No, I got you.
Don't wanna interrupt your flow. It's fascinating.
No, for sure. So the thing that's important about that is when we did that work a year ago with Harvard, and then COVID happened and everything stopped. One of those companies, though, had that sale, had started into those accounts at Harvard University, which allowed her and us to scale up her production, to understand the distribution process, to understand sourcing, which then led us to be in position where we could go with her to Whole Foods. She is now on the account at Whole Foods in the entire region of the North Atlantic region in 45 stores, about to go into Stop and Shop. All of that was because Harvard said yes. We want to do it. And it's not just that we want to do it, we're going to align all of our resources to make sure that this happens. And that is the kind of change that if we all can lean in different ways and understand that there is enormous complexity in this. And I touched at this, what the complexity of it is. And that's why our food economy is so stuck. But there is the opportunity, if we can be intentional the way that Megan talked about, that we actually can change the market dynamics and not only support the regional food economy and our farms, but also really think about how we lean into the racial equity and racial justice lens of supporting our small minority and women-owned businesses. So you can go to the next slide. I think that's kind of we'll see what else. So this is just the impact of us as an organization. You get a feel for all of the things we do. I did not talk about the work we do with restaurants or emergency food work, or again, that is simply about having infrastructure and then looking just like BMC is doing to say, how do we use what we are doing to create real systems change? You can go to the next slide. So we pivoted. I don't need to spend time on this. You can keep going. So I actually think, I apologize, this is a new slide deck for me. So these are pictures of business owners of ours that were actually on the menu at Harvard. You can keep going. This is RY, same as what other people have talked about. This is a tasting that we did with our business owners with the head chef at Harvard University. You can go to the next one. And here you see kind of the stories in the globe of the things that we are doing and supporting. This woman is a Cameroonian refugee who makes what was a peanut sauce that we got rid of the peanuts to get her on the menu at some colleges, which was not a simple thing for us to do. But essentially you get a sense of what we are trying to do. I guess I'll just wrap to say that this work is enormously complex. It's very, very hard to do. The keys to me are about aligning resources and creating values aligned across all parts of the distribution network, all parts on the institutional side. You need the Megans of the world, you need the Davids of the world, or it's not going to get done. And you have to be thinking about it as change management and systems change, because if you don't do that, then it becomes about individuals and not about actual change. So that's my work.
Great, thank you, Jen. That's again really inspiring. We totally appreciate that. The complexity and the devil is always in the details. So that's great. We're going to pivot a little bit and move on to Ben Myers and focus not on food but on energy with the really creative things that they've done with community energy. So Ben, I'll turn it over to you.
Sure. Thank you, John, and thank you for having me this morning. Amazing work, Jen. And I don't think the world can have enough cookies. So I vote for more cookies. I'm going to talk about community solar, really pivoting from food and healthcare to commercial real estate. And I'm Ben Myers, Vice President of Sustainability at Boston Properties. Next slide. Next slide. Next slide. So save some time. So we're a commercial REIT, publicly traded, and we develop, own, and manage Class A office space. And today happens to be my birthday, and I've been reflecting on the fact that I've spent a quarter of my life building a sustainability program at Boston Properties that has earned international recognition, ranking among the top 4% of all global public and private real estate companies. And very much aligned with the GRC, with Brian Koop as our longstanding member and spiritual warrior on sustainability. Climate action is at the top of that strategy, the first pillar. And so our strategy involves climate action, resilience, and social good, and spans from green buildings to climate risk to diversity, equity, and inclusion. Obviously can't cover it today, and I think I've learned that you can't fit 6 anchor institutions with so much content into a 90-minute block. That's just not possible. So that's a good problem. Call that a champagne problem, John. Next slide, please. So one of the things I'm very proud of at Boston Properties are public targets. We've been very intentional. That word has come up a few times on energy emissions, water, and waste, operating healthy and sustainable workplaces while also recognizing the externalities of our business and really measuring and managing those externalities at the asset level across a portfolio of about 150 properties, 42 million square feet in our actively managed office portfolio. A couple of highlights: we've cut our energy use intensity 27%. That stabilized pre-COVID since 2008, and we've cut our greenhouse gas emissions 70% on a per square foot basis since 2008. Next slide. And this is just meant to show the decoupling of energy use intensities from carbon emissions, and a big strategy or piece of that that's driving these reductions in carbon intensities is solar. So I'm going to talk about community solar specifically with a couple minutes, but I just wanted to highlight the blue line, which is energy use intensity. That's energy use per square foot. And the green line, which is carbon intensity, that's carbon use per square foot, has become decoupled. So as we've grown, we've discovered ways through additional renewable energy and energy efficiency to reduce the amount of energy we consume per unit area and also the amount of carbon emitted as a result of that energy consumption. Next slide, please. So this walks you through what's happened since 2008, left to right. Left is our base year. The blue is energy. The green is carbon. Every 100 units of energy we consumed across our portfolio in 2008 resulted in 105 units of carbon. And this is in hectograms of carbon. If you move all the way to the right, every 100 units of energy we consume today across our portfolio is responsible for 18 units of carbon. So a very, very large transition that's been driven by energy efficiency, high performance new construction, and the procurement of renewables. Next slide, please. And the results for our business have been phenomenal. We were able to set a science-based target aligned with the 1.5 degree level, which was approved by the Science Based Target Initiative. Very strong voluntary leadership signal. We're one of only 6 North American property companies to have set that target. And we're the only office company to have a target at the most ambitious 1.5 degree level. In the Global Real Estate Sustainability Benchmark Assessment, our ESG scores have risen, which matters more to our stakeholders, particularly institutional investors that care more about sustainability performance. And finally, we've saved a lot in operating cost avoidance. We avoid more than $30 million a year in annually recurring energy-related operating expenses. Next slide. So I wrote my master's thesis when I joined the organization about 10 years ago on solar and how to accelerate solar in commercial real estate. And what I learned is solar projects require tremendous buy-in and stakeholder consensus. And there are a lot of stakeholders involved in a solar project, from legal to property management, leasing, construction, development, marketing, executive leadership. You have to have a great partner. And the partner I'm going to talk about today, CommonWealth, is one of those great partners. You need a utility that's willing to work with you on interconnection. Local municipalities that want solar and want to advance and support solar projects, and the GRC is really helping drive that conversation. And then state and federal governments. All of those need to buy in to get a project built. Next slide. So this was our first project in 2014, took a barren wasteland of a garage parking deck in Waltham, Massachusetts, overlooking the Cambridge Reservoir. Beautiful site. Bay Colony in Waltham. And next slide, converted it from a parking deck to an energy system that produces 20% of the total energy requirements for the building next to it, seen here in this picture, renewably. So that was an eye-opening moment for me. We got the benefit of covered parking. We got reduced operating expenses with the solar, and we reduced our carbon emissions with the largest garage-mounted solar canopy in New England. Next slide, please. And I took that model and just last year completed a 5.2 megawatt system in Princeton, New Jersey, at a site we own, a set of sites known as Carnegie Center. And there we're producing now over 100% of the energy required to operate 4 of our buildings in that complex with surface mounted solar canopies. Next slide. And here, the hub on Causeway, we just finished. This is the redevelopment of North Station. This is the office tower, the Verizon Tower down on Causeway Street. 30 stories up, we have our tallest solar array, and I believe the tallest solar array in the city of Boston that we just commissioned. Next slide. So what is community solar? It's a strategy for sharing the benefits of renewable energy with the community. So this is a schematic that we'll start from left to right. We have a BXP building. This is our building 10 and 20 City Point. It's the garage that serves those 2 buildings. We have solar above the deck. We serve energy to the local distribution company through a net meter. And then the local distribution company, Eversource, distributes net metering credits that have a dollar value to Boston Properties and to qualified ratepayers. It's very important at the center of this transaction that you have a solar developer that knows how to execute this type of strategy. And CommonWealth, again, John Abe has been a tremendous partner for Boston Properties all the way back to our early days of solar development. He's been involved in nearly every project. So you work with a qualified solar developer to identify ratepayers that get the benefit of the net metering credits less than 25% savings. We also get savings from the value of the net metering credits that we return to a portion of to the developer to help underwrite the project. The project was delivered completely turnkey by CommonWealth. So this is value creation with no upfront and capital cost from Boston Properties. There is some oversight. We do some engineering, certainly personnel time of our many people in our company. I showed you the stakeholders, but no upfront capital, which helps get a lot of these projects built. Next slide. So some of the benefits of this project: 614 kilowatts of DC current. So about 697,000 kilowatt hours produced renewably a year. It's located on the garage shown here. This is the City Point, 10 and 20 City Point on Totten Pond Road. What you're seeing is a large 128, and that's the Cambridge Reservoir, the body of water there. If you want to go out and see it, the garage is open if you want to take a look. Lifetime benefit, $780,000. So we produced from nothing $780,000 worth of value. Boston Properties received some of that value, and local low-income off-takers like Caritas Communities, Heading Home, and other ratepayers get about $10,000 of savings on their utility bills every year. And for low-income residents, utility bills are a large percentage of your net income. So this is a very, I think, important method of addressing energy poverty. Next slide. These are some pictures of the project. On the upper left, you see the beams, the support beams going in, and the purlins on top of those beams, and some of the early conduit going in. The columns obviously mounted to the top of the garage. We built this project through the pandemic. Solar was a great way to stay occupied. I'll say this was the highlight of my pandemic, building this solar project. Next slide. And on the left, like when my daughter was out of school, I have three girls, but my eldest daughter was out of school, and we were looking for learning opportunities. She told me last night that's her with the construction manager. So we got to do a day with our construction manager, Katie Onis, and walk the whole site. And she learned what a construction manager does. And Katie was a great model for her. I asked my daughter this morning what her favorite hybrid learning experiences were, and she said, first was this crane and seeing the solar go in. So it was the most valuable educational experience for her. Second was dissecting owl pellets we found in our backyard. And the third was building a shed. So I'm happy to hear that solar ranked #1. Next slide, please. And also, another benefit aside from the purpose and value I get, obviously showing my family how we're contributing positively to the world, is the green jobs. All these projects have kept a lot of people employed and busy through the pandemic. And I think that's a huge opportunity for community solar to scale beyond just the owner or developer or ratepayers that are off-taking energy to reduce cost. We can scale this benefit to the community by creating more of these green jobs. Next slide. That's it. Thank you.
Great, terrific. Thank you, Ben. That's really inspiring. Um, and thank you to all of the panelists. I think as planners of this event, we should have known that we couldn't put 6 really passionate people on anchor institution strategies together and have anybody keep within their time limit. So I don't really think we care, because we love to hear what you have to say, and it was totally great. But we do have about 10 minutes here left for Q&A, and I want to just ask one question at the beginning, and then we'll jump into the audience questions. Is Gary, you kind of laid down the gauntlet of, let's do something around anchor institutions in Boston that's unique in the country. For all of you panelists, if you just had any ideas about if we wanted to move forward on a really integrated anchor institution strategy in Boston across multiple sectors that would really just advance this game in many of these content areas, what are your ideas about how we should start that? Just quickly, any brainstorming you have.
Well, just quickly, I'll just say, over the last couple of years, the healthcare organizations used to do their own community health needs assessments, and now they're starting to do them together. And in the same way, there's an opportunity to map the opportunities, the assets, the needs that we have across Boston around energy and food and transportation and housing and other core services and core strategies, and then build this aggregated demand and strategy across the colleges and universities and hospitals in the city. I mean, we just have all of the conditions that are ripe, and the Green Ribbon Commission could be a convening for that initiative.
Thanks, Gary. Any other thoughts on that front before we go into some of the specific questions?
Just on the solar piece, obviously robust community solar programs that are marketed well to local residents and contracts that are easy for local residents to sign to do community solar without penalties. I think that CommonWealth has done a really good job paring down that contract to 2 pages, again, with no penalties, and making it really easy for people to opt in to get the benefit of low income solar net metering credits. And then secondarily, I think we need less risky interconnection process where there's more certainty that you can become interconnected, almost like an as of right interconnection for a certain amount of renewable energy. We waited 9 months for our internet connection application for the City Point project, and that was an expedited interconnection application with Eversource. So we need to refine that program and get these interconnection applications processed more quickly, and give development community more certainty that they can get a project interconnected so they can make the investment in doing the conceptual design work necessary.
Great, thanks for that. A number of GRC members have had the same kind of issue, and we have Eversource on the GRC, so we can initiate that conversation relatively easily.
John, I would just one thing I would just add is that on the procurement side, I do think it's a really interesting moment given what happened in the last year or so, and thinking about procurement in the city of Boston and how poorly the city's been doing and the state has been doing. And there's a lot of community organizations that are pushing hard on what can we do to really improve things. I think that, Megan, I appreciated hey, here's what we did, and in the course of 2 years, how much we improved, and yet it's not enough. But that's a powerful statement about what you were able to do. To go from 2 million to 22 million in less than 2 years is an incredible feat. And I do think raising up those examples of what we're doing in this moment, where at the city and the state, there are a lot of conversations across all parts of our work, thinking about procurement as a key. And so where are the healthcare, the leader in that, I think is a very powerful opportunity.
Yeah, that's a great reminder, Jen. And I know that there have actually been some conversations specifically on this issue within City Hall with John Barros and some others. And I'm sure this is an issue that Mayor Janey would be totally happy to help champion. So that's a great leverage point. There was one really specific example, and I think this is probably to you, Megan, which was how clinicians can really perform environmental health consultations during their clinical encounters, so that that's a natural process of sort of building the identification of something that needs to happen with specific, patient, but also your sort of broader strategy. Do you have any suggestions on that front?
Yeah. Yeah, thank you so much for the question. And I really encourage the doctor who put it in, and I'm sorry, I want you to tell me how, Berenji, I hope I'm saying your name right, and please correct me via email if I said it wrong, is that I do think that we should be building more capacity to understanding both the occupations of our patients, and then also doing more active screening to help people with what I would consider lattice opportunities. Sometimes people get stuck in the job pathway they're on. They need to move to another job pathway to be able to then move up. And it's a real point of pride at BMC that we are starting pathways programs to get people from coordinators to managers, and then managers hopefully to directors as you earn more and more money. And I just think, I understand the housing world. I've been in it for a little bit of time. I don't understand career pathways well enough, and don't understand procurement. Jen, you need to educate me a lot more. I just feel like we need to do processes differently. Where the city, I think, fell down is they made a commitment and they did not change the process at all. And that is the problem. We need to change the processes. And if we don't change the processes, and I think to Ben's point, right? Like, what are the pinch points, right? Is it a contract? Is it a bidding process? Do you need to chunk Sheldon Lloyd talked about chunking the contracts into more biddable pieces. Like, all of that is process pieces that we need to lean in on. And so I do think how we redesign care, to your point, is having navigators that understand the housing system and know how to pick up the phone. And I think we are trying to really build that out in pediatrics as an example. But I do think, just to give you one example, we've gotten the RAFT application time down to 21 days, and the state average is 45 days, because we built an intentional process with a co-location site with Metro on site, and having co-navigation with families to talk to landlords directly and get the paperwork in. So I think we can do a lot of quality improvement. So please email me. I have an easy email, megan.sandel@bmc.org. I want to follow up with you. Thank you.
Great, thanks, Megan. And I think, again, as I think it was Jenna said, the devil is in the detail, and there's really good research in the diversity and inclusion world that you can do all of the D&I training on implicit bias you want, but if you don't change institutional practices in these areas in really concrete way, you don't get different results. So it is 10 o'clock, so unfortunately our time is up. I want to thank all of you for the incredible, inspiring information that you have given us. And we will be following up. This is part of the GRC strategy to figure out how we build an anchor institution, initiative and sort of peer practice network in Boston. So you'll be hearing more on this. If you could, oh, Lizzie beat me to the punch. You will be, when you get the follow-up from this, you will also get an invite to our next GRCx, which is the second in our series on climate health and equity. The first on that was the highest participating GRCx we've had yet. So it's a great program. Urge you to join it. And thank you for taking the time, and thank you to all of the panelists. We hope that this will be a stirring call to action for future work. And with that, enjoy the rest of your day.